Asthma is a common lung disease which affects millions of people worldwide. Asthma can interfere with your daily activities and your sleep, but it does not have to be that way. Kids with asthma can live normal, healthy lives. You should be able to do all the activities you want to do. You should be able to keep up with your friends, play sports, and sleep throughout the night without coughing or wheezing. You should not have to miss school frequently. Most importantly, you should be able to avoid trips to the emergency room or the hospital. It only takes a few minutes a day to take your asthma medicines and keep yourself feeling great. In this video, we will teach you what asthma is and give you some tools to keep your asthma under control. Let's take a look at what happens in your lungs during an asthma attack. During an asthma attack, the breathing tubes or airways in your lungs become swollen and filled with mucus. Doctors call this inflammation. The muscles around the breathing tubes spasm and cause the wheezing noise you hear when you breathe. Because the breathing tubes are narrowed from the swelling and the muscle spasm, your chest can hurt and it may be hard to breathe. This inflammation can be caused by many different triggers, such as a cold virus, smoke, pollen, changes in the weather, or even stress. Different people have different triggers.
It feels like I can't catch my breath.
I can't stop coughing.
I'm wheezing all the time.
My stomach hurts.
My chest hurts.
Babies and toddlers can't tell us what is wrong and may be more fussy than usual, or not want to feed during an asthma attack. During a severe attack, babies may be more sleepy than usual. Cyanosis, or a blue tinge to the lips, is a late and concerning sign. Remember, early in an asthma attack, you might have coughing, wheezing, or chest tightness. But if the asthma attack becomes severe, you will have a hard time breathing. Sam is having trouble breathing during a severe asthma attack. He is breathing fast, breathing with his belly, having chest retractions, nasal flaring, and grunting. We just showed you what happens during an asthma attack, but even when you are not having an asthma attack, you may have mild symptoms indicating that your asthma is not well controlled. Nighttime coughing is particularly common. Coughing with exertion is another common sign. You should talk to your doctor if you are experiencing any of these problems. There are many different types of asthma medicines, and when used as directed, your asthma can be kept under control, allowing you to lead a normal and active life. Do not stop any of your prescribed medications without first talking to your doctor. During an asthma attack, you need treatment with a fast-acting rescue medication such as albuterol, which is a short-acting bronchodilator or a beta-2 agonist. These medicines relax the muscles around the airways and relieve the spasm. They are used during an asthma attack to relieve the sudden symptoms of wheezing, shortness of breath, chest tightness, and coughing. They do not help with the underlying inflammation, which causes airway swelling and mucus. If you need to use rescue or quick relief medicine more than twice a week, then your asthma is not well controlled, and you should see your doctor. Your asthma medications may need to be adjusted. Some people feel shaky, have a rapid heart rate, or feel anxious after using an inhaled short-acting bronchodilator. During a severe attack, your doctor may prescribe a short course of oral corticosteroids to decrease inflammation in the airways. These medicines usually start working several hours after the medicine is taken. Systemic corticosteroids may be given by mouth or through a special IV and quickly help out-of-control asthma. But because the medicine goes to the whole body, frequent use may lead to serious side effects, including effects on growth, bone density, eyes, skin, the adrenal gland, and the immune system. Long-term controllers or preventative medicines are taken daily, even when you are feeling great, to decrease inflammation and reduce the swelling in the lining of the airways. Your fast-acting rescue medication cannot reduce this swelling. With the proper use of controller medicines, you can avoid the complications that result from overuse of quick relief medicines and prevent severe attacks requiring hospitalization, emergency room visits, and treatment with systemic corticosteroids. There are many forms of asthma controller medicines. Talk to your doctor to figure out which one is right for you. Inhaled corticosteroids are the most commonly used and most effective asthma controller medicines. The most common side effect from inhaled corticosteroids is thrush, a yeast infection in the mouth. With proper inhaler or nebulizer technique and rinsing the mouth after each use, the risk of this side effect can be minimized. While some studies have shown slowed growth in children taking inhaled corticosteroids, the risk is lower than taking repeated courses of systemic corticosteroids. Your doctor will monitor your growth closely. To minimize the risk of adverse effects of inhaled corticosteroids in children, we recommend using the lowest possible dose of inhaled steroids to maintain symptom control. Your doctor may prescribe a second asthma controller medication to try to decrease your steroid dose. Managing your exposure to triggers may also allow you to decrease your steroid dose. A long-acting inhaled bronchodilator, also known as a LABA, is often recommended in combination with an inhaled corticosteroid for patients with persistent asthma. Examples of these combinations are Advair and Symbicort. Long-acting bronchodilators work for 12 hours or more, much longer than your regular short-acting beta-agonist albuterol. LABAs do not work as quickly as your short-acting beta-agonist, and they should not be used as a rescue medication. Singulair, montelukast, is another asthma medicine which works by decreasing inflammation and decreasing mucus production in swollen airways. It is usually taken by mouth as a pill once daily and has very few side effects. Compared with inhaled corticosteroids, Singulair is generally less effective in controlling asthma. However, for some patients, especially those with allergies, Singulair can be very helpful. Allergy medicines can sometimes help to control asthma which is triggered by allergies. Examples of allergy medicines are antihistamines, such as Claritin, Zyrtec, Allegra, or Benadryl, or nasal steroids, such as Flonase or Rhinocort. Rarely, patients with severe and persistent asthma are treated with chronic oral corticosteroids. Your asthma doctor should give you a new asthma action plan or review your old asthma action plan at every visit.
My asthma action plan helps me manage my asthma. I keep one copy on the refrigerator and one copy at the nurse's office at school. My asthma action plan has 3 zones: green, yellow, and red, just like a traffic light. Green means go, yellow means caution, slow down, and red means danger, stop. My goal is to always stay in the green zone where my asthma is under control and I'm feeling great.
In the green zone, you are feeling great and your lungs are working well. Your asthma is under control. Good job! You should continue your daily controller medicines and continue your regular activities. In the yellow zone, you are just starting to get sick. The yellow traffic light tells the traffic to slow down and be careful. In asthma, the yellow zone indicates that the airways in the lungs are narrowed due to muscle spasm, swelling, and mucus. This narrowing makes it hard to breathe. Your asthma symptoms may be more frequent or more severe. You may start coughing, wheezing, or feeling chest tightness or shortness of breath. You should start your fast-acting rescue medication according to the plan that was discussed with your doctor. Often your doctor recommends taking 2 puffs of your short-acting beta-agonist every 4 hours as needed. The red traffic light tells cars to stop because there is danger ahead. For asthma, the red zone means you are very sick. You need to treat your asthma now because you are in danger. You may be feeling very short of breath and have frequent wheezing or coughing. Your asthma symptoms may not be responding to your usual asthma medicines, or you may be needing your treatments more often than every 4 hours. If you have these symptoms or your symptoms are not improved after using the yellow zone therapy for 24 hours, you should call your doctor immediately for help. You may need to call 911 or go directly to the emergency room for help. You will need to be treated with bronchodilators and systemic steroids like prednisone. While you are waiting for help, you should continue to use your fast-acting rescue medication, usually albuterol. You may give nebulizer treatments back-to-back, or 4 to 8 puffs of your short-acting beta-agonist every 15 to 20 minutes while you are waiting for help. Severe asthma attacks can be fatal if not treated promptly. It is not safe to give this much medicine at home for an extended time, and this is only recommended as an emergency backup plan while you're waiting for help to arrive. The factors that set off and worsen asthma symptoms are called triggers. Common triggers are infections such as colds or flus or changes in the weather. Other common triggers are allergens or pollutants such as animal dander, dust mites, pollens, molds, smoke, and other chemicals. Some people with asthma are triggered by stress and strong emotions. Exercise is a very common trigger. Identifying and avoiding asthma triggers are important steps in preventing asthma attacks. Prevent infections by washing your hands frequently. Get your regular immunizations and the flu shot if your doctor has recommended these for you. When you get sick, be sure to follow your asthma action plan. If you are allergic to animals, try to avoid them and especially try to avoid touching them. If you can't avoid them entirely, remember to wash your hands frequently and wash your pets regularly. Maybe this is the time to convince your parents to get you a snake or another animal without fur. Dust mites live all around us in our bedding and in our carpets. Wash bedding in hot water weekly. Vacuum and dust regularly. You may consider buying mite-proof covers for pillows and mattresses. When the flowers, grasses, and weeds outside are triggering your allergies, try to stay indoors. Also, use your oral allergy medications and nasal steroids regularly to try to keep symptoms under control. Decrease mold exposure by keeping the humidity low in your bathrooms and basements. If you can see mold anywhere in your house, try to clean it up. Avoid fumes and chemicals whenever possible. If your parents or grandparents smoke, try to get them to quit. If you live in California, tell them to call the Stop Smoking helpline at 1-800-NO-BUTTS. If they can't quit, ask them to smoke outside of your house and your car. Make them change their clothes and brush their teeth when they come back inside. If strong emotions and stress trigger your asthma, try to avoid stressful situations and find ways to manage your stress. Regular exercise is important for everyone, even people with asthma. Exercise can be a trigger for some children. However, with good asthma control, you should be able to do any activity you want. Exercise actually improves your airway function by strengthening your breathing muscles. The key to safe exercise is to work with your doctor to make sure your asthma symptoms are controlled. Here are some tips for exercising with asthma. First, have an asthma action plan in place. Communicate regularly with your teachers and coaches. Carry a quick relief medication for use during recess, PE, practice, and games. Make sure you stretch before and after exercising. Take your quick relief asthma medication 10 to 15 minutes before exercising, as recommended by your doctor. If asthma stops you from being active, your asthma is out of control and you should see your doctor. Using asthma medications properly can be difficult, but good technique is critical to good asthma control. Infants and children will need to use an inhaler, often called an MDI, with spacer and mask until they are able to hold their breath for 10 seconds. The spacer with mask comes in sizes small, medium, and large. Every time you use your inhalers, you should use a spacer. 1.
Remove the cap off the mouthpieces of the inhaler.
2.
Shake the inhaler for at least 5 seconds before use.
3.
If your inhaler is new or if you have not used it in the past 2 weeks or if you have had dropped it on the floor, you will need to spray the inhaler 3 to 4 times to get the inhaler ready to deliver the medication. Check the package insert or check with your doctor for details about your inhaler.
4.
Fit the inhaler into the spacer.
5.
Apply mask to your child's face and make sure you have a good seal. Many spacers have a little flap called the inspiratory flow indicator, which only moves if you have a good seal.
6.
Breathe out gently and depress the inhaler at the beginning of a slow inhalation. Maintain the seal and watch the inspiratory flow indicator move back and forth for 6 breaths after the MDI is depressed.
7.
Wait 1 minute before taking the next puff of medication.
After you've used your inhaler and spacer, rinse out your mouth with water to help reduce unwanted side effects: oral thrush, sore throat, and hoarse voice. Do not swallow the water. For infants and toddlers using a spacer with mask, wipe the child's face and mouth with a wet towel after use. Keep track of how many puffs you have used and when your child is due for a refill, because it is not possible to tell if the inhaler is empty just by shaking or spraying it. Common mistakes are not shaking the canister each time, not making a good seal with the child's face, not holding the mask in place for 6 full breaths, not waiting 1 minute before repeating a puff, not priming your inhaler, not knowing when your inhaler is empty. Ask your doctor to show you again if you still have questions about how to use your inhaler and spacer. It is important to clean your inhaler and spacer. The inhaler mouthpiece should be washed at least once a week to prevent medication buildup and blockage. To clean it, remove the metal canister and cap from mouthpiece. Set the canister and cap aside. Never wash or immerse canister in water. Wash mouthpiece under warm running water for 30 seconds. If your inhaler has a dose counter, do not rinse with water. Use a cotton-tipped applicator to clean the spray area and wipe the mouthpiece with a clean cloth. Shake off excess water and allow it to air dry overnight. To clean your spacer, remove the back piece of the spacer but not the mask. Wash all the parts in clean, warm, soapy water. Rinse in clean water. Shake off the excess water and allow the pieces to air dry. Reassemble the pieces when dry. Using asthma medications properly can be difficult, but good technique is critical to good asthma control. Older kids who can hold their breath for at least 10 seconds can use an inhaler or MDI with a spacer and a mouthpiece. Every time you use your inhaler, you should use a spacer. 1.
Remove the cap off the mouthpieces of the inhaler and spacer device.
2.
Shake the inhaler for at least 5 seconds before use.
3.
If your inhaler is new, or if you've not used it in the past 2 weeks, or you have dropped it on the floor, you will need to spray the inhaler 3 to 4 times to get the inhaler ready to deliver the medication. Check the package insert or check with your doctor for details about your inhaler.
4.
Fit the inhaler into the spacer.
5.
Breathe out slowly and completely away from your spacer to empty your lungs.
6.
Place spacer into your mouth and close your lips tightly around the mouthpiece. Make sure your tongue and teeth are not blocking the opening.
7.
Press down on the inhaler firmly to release the medication.
8.
Breathe in slowly. Keep breathing in slowly until you have taken a full breath. You should not be able to see any mist escape from your mouth or nose.
9.
Remove the spacer from your mouth. Hold your breath for 10 seconds, if possible. Allow the medication to go deeply into your lungs, then breathe out.
10.
Wait 1 minute before taking the next puff of medication.
After you've used your MDI and spacer, rinse out your mouth with water to help reduce unwanted side effects, such as thrush, sore throat, and hoarse voice. Do not swallow the water. Keep track of how many puffs you have used and when you are due for a refill, because it is not possible to tell if the inhaler is empty just by shaking or spraying it. Common mistakes are not shaking the canister each time, not breathing out completely before using your inhaler, not holding your breath for 10 seconds after breathing in the medicine, not waiting 1 minute before repeating a puff, not priming your inhaler, not knowing when your inhaler is empty. Ask your doctor to show you again if you still have questions about how to use your inhaler and spacer. Remember, even big kids still need reminders to take their medicine and supervision to make sure they are using proper technique. It is important to clean your inhaler and spacer. The inhaler mouthpiece should be washed at least once a week to prevent medication buildup and blockage. To clean it, remove the metal canister and cap from mouthpiece. Set the canister and cap aside. Never wash or immerse canister in water. Wash mouthpiece under warm running water for 30 seconds. Shake off excess water and allow to air dry overnight. To clean your spacer, take it apart. Wash all the parts in clean, warm, soapy water. Allow the pieces to air dry. Reassemble the pieces when dry. Using asthma medications properly can be difficult. However, good technique is critical to good asthma control. A few asthma medications, for example Advair, come in a discus. The discus is a dry powder inhaler. Dry powder inhalers eliminate the need to coordinate taking a breath and squeezing the canister. Dry powder inhalers deliver a fine powder to the lungs when you breathe in. Only big kids can use a dry powdered inhaler because you need to inhale more forcefully than with a traditional aerosol inhaler. 1.
Open the device by holding the outer case with one hand and placing the thumb of the other hand on the thumb grip attached to the cover. Make sure to keep the discus flat like you are holding a hamburger.
2.
Using the thumb, push or rotate the cover sideways, counterclockwise, as far as it will go until a click is heard.
3.
With the mouthpiece facing you, slide the loading lever away as far as it will go until it clicks. Do not touch the lever until you are ready to use it.
4.
Breathe out slowly and completely away from the discus.
5.
Place mouthpiece between your lips and teeth and close lips firmly around it.
6.
Breathe in steadily and deeply as you can until your lungs are completely full.
7.
Remove discus from your mouth and hold your breath for 5 to 10 seconds.
8.
Breathe out slowly. If you think you did not get the whole dose, hold the discus with the mouthpiece pointing down over a dark surface and tap. If white powder spills out, adjust your technique to make sure that you are breathing in fast enough to get all of the powder into your lungs.
9.
Close the device by sliding the thumb grip back towards you as far as it will go.
After you've used your discus, rinse out your mouth with water to help reduce unwanted side effects, such as thrush, sore throat, and hoarse voice. Do not swallow the water. The counter on the front of the device will count down to 0 with each dose. To clean the mouthpiece, wipe it with a dry tissue. Do not immerse it in water. Using asthma medications properly can be difficult, but good technique is critical to good asthma control. A few asthma medications, for example Pulmicort, come in a flexhaler or turbohaler. The turbohaler or flexhaler is a type of dry powder inhaler. Dry powder inhalers eliminate the need to coordinate taking a breath and squeezing the canister. Dry powder inhalers deliver a fine powder to the lungs when you breathe in. Only big kids can use dry powder inhalers because you need to inhale more forcefully than with a traditional aerosol inhaler. 1.
Load the medicine by holding the inhaler upright and twisting the colored grip on the bottom in one direction until you hear a click, then twist the colored grip back the opposite direction as far as it will go.
2.
Breathe out slowly and completely away from the turbohaler.
3.
Tilt your head back slightly. Place mouthpiece between your lips and teeth and close lips firmly around it.
4.
Breathe in quickly and deeply as you can until your lungs are completely full.
5.
Remove the turbohaler from your mouth and hold your breath for 5 to 10 seconds.
6.
Breathe out slowly.
7.
If a second dose is ordered, repeat these steps.
After you've used your turbohaler, rinse out your mouth with water to help reduce unwanted side effects such as thrush, sore throat, and hoarse voice. Do not swallow the water. The counter on the device will count down to 0 with each dose. Clean mouthpiece once a week and as needed with a dry tissue. Never use a wet cloth. Store in a clean, dry place, preferably not the bathroom as it is too humid. Using asthma medications properly can be difficult, but good technique is critical to good asthma control. 1.
Always start with a clean nebulizer cup. Fill the nebulizer cup with the prescribed amount of medications.
2.
If you were instructed to use the mask, attach mask directly to the nebulizer cup.
3.
Connect tubing from the compressor to the bottom of the nebulizer cup.
4.
Turn on air compressor.
5.
If you are giving the treatment to a small child, place the mask over your child's nose and mouth so that the mask touches the skin directly. If you are giving the treatment to an older child, you can use the mouthpiece or place mask over mouth and nose. Breathe in the mist slowly and then breathe out slowly. Do not use blow-by technique. If the mouthpiece or mask is held away from the face, the medication will be lost and you will not get the full benefit of the medicine.
6.
Continue until medication is gone or you hear a sputtering sound.
7.
Turn off air compressor.
8.
Disconnect tubing from bottom of cup.
It is important to clean your nebulizer regularly. Please follow the detailed specific instructions from the manufacturer of your nebulizer kit. After you've used your nebulizer, rinse out your mouth with water to help reduce unwanted side effects: oral thrush, sore throat, and hoarse voice. Do not swallow the water. For infants and toddlers using a mask, wipe the child's face and mouth with a wet towel after use. In general, you should rinse the nebulizer cup and mask after each treatment and disinfect the nebulizer cup weekly. After each treatment, rinse the nebulizer cup and mask with hot tap water. At the end of each day, wash the cup and mask in hot soapy water. Rinse well. Allow to air dry. Do not wash the tubing. If the tubing gets wet on the inside, get new tubing. You should disinfect the nebulizer at least once a week. There are several choices for disinfecting the nebulizer cup. 1. Wash in a dishwasher if the water temperature gets above 158 degrees for greater than 30 minutes. 2. Boil in water for 5 minutes. 3. Soak in 70% isopropyl alcohol for 5 minutes and rinse with sterile water. Or 4. Soak in 3% hydrogen peroxide for 30 minutes and rinse with sterile water. Check the manufacturer's instructions for care and cleaning of the compressor. In particular, look to see how often the filter needs to be changed. Stay healthy. Control your asthma. Take your daily controller medications. Have an asthma action plan in place. Keep one at home and give one to your school and your coach. Know the early warning signs and treat your asthma symptoms as soon as they start. Avoid your asthma triggers. Know how to get help if you are getting worse. See your asthma doctor every 3 months for a checkup.
My son does not like the mask. Do I have to use it?
That's a really common problem, but in fact not using the mask with the nebulizer decreases the amount of drug delivered by a great amount. Just holding the nebulizer a quarter of an inch away from the face decreases it by 50%. And holding it 3/4 of an inch away, you'll only get about 20% of the dose actually delivered. There are several reasons why you need to use the spacer. If you put the mouthpiece directly in the mouth, most of the drug gets deposited on the palate and the back of the throat, and you really don't get much delivery. You also tend to get a lot of leakage. The spacer really improves the efficiency of delivery of drug from a meter dose inhaler. Usually if a child is old enough to hold their breath to a count of 10, they can use a spacer without the mask on it and just the mouthpiece. It'll vary somewhat, but somewhere between 4 and 6 years of age is generally the time that happens.
Can I give a treatment while my son's crying?
When your child cries, although he seems to take big breaths at times, this is really not a very good time to use an inhaler or a nebulizer. Crying decreases the delivery of the drug significantly.
Can I give a treatment while my son is sleeping?
Actually, giving the treatment while the child sleeps is not a bad idea. The amount that actually gets into the airways is sufficient to do the job.
Is a nebulizer better than an MDI?
Actually, the nebulizer isn't better than the MDI. The most important thing is that your child tolerates whatever technique you're using. But an MDI with a spacer and a properly fitting mask or mouthpiece can be just as effective as the nebulizer.
Is my child old enough to use an MDI?
You can use an MDI at virtually any age with a spacer that has a properly fitting mask or a mouthpiece, depending on the age of the child.
How can I tell if my MDI is empty?
We like people to use MDIs these days that have built-in counters. That's really the most effective way. The other alternative is to count. In the old days, we used to tell people that they could take out the canister and see whether it floats or not, or shake it. But really, with the new propellants that we have in the modern inhalers, that doesn't work anymore, and it's not recommended.
Why do I have to prime the inhaler?
You should prime your inhaler every time you get a new one, or if you haven't used yours in quite a while. The first time, or a couple times you pump it, there'll be no medication, just the propellant, which helps the medication come out. You should look at the packaging, because every brand is different on how many times you need to prime it.
I've heard that steroids are dangerous. My child was given prednisone in the hospital. Are steroids safe for my child?
It's safe to take steroids for short periods of time, such as for an asthma exacerbation. When you take steroids for a longer amount of time, it can cause problems with different parts of your body. The main concern is with growth or causing problems with your bones or diabetes.
Are inhaled steroids safe?
Inhaled steroids are very safe. They're given in a much smaller dose than you would get with oral steroids that you would take, for example, after a hospital admission for asthma. When you take an inhaled steroid, the steroid goes right to your lungs, and so we can use really small doses. The most common side effect with inhaled steroids is thrush, which is a yeast infection in the mouth. Even though that's the most common side effect, it's also relatively uncommon and is easily treated with oral medication.
Why should I give my daughter a medicine every day when she's not sick?
In children with persistent asthma, it's recommended to use a daily inhaled steroid. We use a daily inhaled steroid to prevent severe exacerbations requiring systemic steroids.
Does he need this medicine forever? Will he ever outgrow his asthma?
The children who develop asthma symptoms later in life, have severe allergies, or a strong family history of asthma tend to continue to have asthma more frequently.
I've heard that long-acting beta agonists are dangerous. Are they harmful for my child?
Long-acting beta agonists should never be used on their own to treat an asthma exacerbation. They should always be used in conjunction with an inhaled corticosteroid. They should never be used to control asthma in children who have been well controlled on other medications, including a daily inhaled steroid. If you have questions about long-acting beta agonists, you should ask your child's doctor.
Should my child have allergy testing?
Most children with asthma do not require routine allergy testing. If you notice your child always has asthma symptoms after exposure to a certain allergen, we would recommend that you avoid exposure to that allergen. If you can't tell what your child is allergic to, your doctor may recommend blood tests or skin tests to test for other allergens.
Can my child become addicted to asthma medications?
No, the medicines we use to treat asthma are not addictive. They can be taken every day and they keep on working. If you have trouble picking up your medicine from the pharmacy or you want to stop your medicines, please talk to your doctor first.
How can I tell if my child's cough is from asthma?
Only your doctor can make a diagnosis of asthma. A cough can be due to many different causes, including a cold virus, pneumonia, or even reflux, or an aspirated foreign body. Your doctor may decide to do testing, including x-rays, spirometry, or special breathing tests, or even a bronchoscopy or an airway exam to determine the cause of the cough.
Should my child use a peak flow meter?
Some clinics use peak flow meters to help patients keep track of how their asthma is doing. So a panel of asthma experts actually found that spirometry, which are just breathing tests, are better to help determine how your child's asthma is doing. Peak flow meters are actually effort dependent and sometimes aren't very helpful in showing us when a child's asthma is worse. So here at UCSF, we don't recommend peak flow meters.
When should my son see an asthma specialist?
A general pediatrician can take care of almost all children with asthma. However, if your child is missing school related to asthma, waking up at night coughing related to asthma, needing to use rescue inhaler frequently related to asthma, or going to the hospital frequently or emergency room, then it's really time to see a specialist.